Okay guys, how's that? First time doing our live here. Let's use this setup here and we'll check our sound, everything. I think everything's good. Okay guys, how you doing? Dr. Adam Tice here. So we have a new session today, office hours, and this is designed to, I've had this idea kind of for a while, and it's really, every day things are going on, and I'm thinking of different things in the day, and oftentimes, like a lot of times, like almost every day, there's things that come up in sessions with people and appointments with people, and I feel like I need to tell like 10 people the same thing. And so that was kind of the sort of origin of the idea. So anyway, let's try it out and see how it goes. Again, the topic for today is autoimmunity and food, and I have a couple of points that came up that questions and things that are just the questions about the topic. And so I'm going to speak to those things. And then for future sessions, you guys, you can direct message me or you can email me, drticend@gmail.com. That's drticend@gmail.com. That's the best way to get a hold of me. So for office hour sessions, you guys send me thoughts, questions, topics, and we'll go through and we'll talk about some stuff. So today's topic is autoimmunity and food. And so what I want to do today is go through just, and I have a little bit of notes here to kind of guide me through here, but really this is pretty free flow. It's something that I've been thinking about just recently because it's come up a lot. And so I wanted to sort of put this out there, and partly to put the information out there, and then partly I know when we present the information or talk about the information, when I do that, it will drill down and clarify things as we move through this. So that's the idea, is kind of twofold, is to put the information out there for people because I think this is really, 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 really important. And so to put the information out there, number one, and then number two, for me to be able to drill down on it and clarify my thinking process more by talking about it and by teaching it more. And then the distilled down version, we'll do the same thing. We'll deliver it again, and we'll just continue to deliver and drill down and get more clarity as we kind of iron out the thinking process here, because I think this is super important. And so the topic that we're going to talk about, autoimmunity and food. So just real quick, let's just talk a little bit about, first of all, about what is an autoimmune condition, what does that mean, and then what are some examples of those diagnoses. So basically, autoimmune conditions are conditions where the body basically has a kind of a communication breakdown with itself, and that the immune system is designed by God, and it's the most extraordinary system that we have, and it's all mingled up. The neurological system, the endocrine system, the hormonal system, all these things are so tightly connected. They're essentially one system, but we have to subdivide them to talk about them. The immune system is supposed to surveil and is supposed to protect against anything coming from the outside, making its way to the inside, a virus, a bacteria, etc. And it's supposed to neutralize that. It's supposed to identify that as non-self and then handle it in a certain way and basically neutralize that. So what happens when there's an autoimmune process? The body begins to, instead of producing antibodies for invaders, for virus, bacteria, things that are going to imbalance the system, that are external agents, the body begins to produce antibodies against itself. And so then we basically have this confusion in the system between self and non-self. And I think there are some deeper level implications of that. There are some deeper level understandings of that, about this idea of having clarity on self and non-self, okay? But let's just not get too mystical about the whole thing right now. Let's keep it really, I want to keep it really, really grounded and very practical. And so just going over some of these really grounded practical points. So that's basically what the autoimmune process is going to do. You have this process where the body's making antibodies. Now, what are some examples of that, where that's happening? Where do we see an autoimmune condition? This is going to be, and this is one thing where even there is some misunderstanding, or there's not even clarity on what autoimmune diseases are. Okay, so there are many of them are known. And these are things like rheumatoid arthritis, lupus, MS, Crohn's and UC, the digestive diseases, Hashimoto's, psoriasis, eczema are in this category. And now there is a little bit of a line in there, and this is kind of a new frontier in pathology, is understanding the role of autoimmune and understanding the role of the immune system in general with known pathologies. And I think as time goes on, we're going to be able to connect the dots and understand that basically, I think all pathology is a kind of a derangement of the immune system. So in that sense, it is an autoimmune system. So if there's something going on in the body, and there's a lot of factors here that are going on. So there are, and of course, this is highly individualized, so that makes it even more complex when we have, we have to take into account things like family history, genetics, constitution, biochemical individuality, lifestyle, stress levels, diet, toxicity exposure, environmental toxicity exposure. You got to factor in all of that stuff and then mix all that up, and given the right situation, the perfect storm in an individual, that can turn on an autoimmune process. That can kind of, what they say, unmask or trigger this autoimmune process that was maybe lying there, that may or may not express depending on the variables. If the lifestyle and the epigenetic picture is ideal, that process might not turn on. But put that same individual with standard American lifestyle with a lot of sugar, just a lot of processed food, a lot of junk, a lot of stress, and if that individual, family history-wise, genetically, constitution-wise, has that susceptibility, boom, it can turn it on, and we can start to have issues. So I think the root issue here is the root issue, and this is something that takes years to come about. This process of autoimmunity, although it looks like, for many people, it looks like it turns on and just one day it shows up. But what I'm telling you is that's not true. This kind of thing takes years to unfold and to unmask and to express itself. And what I want to do today is talk about what it is now, what autoimmunity is a little bit, try to kind of understand, okay, what the heck is an autoimmune condition? What's the immune system? But what's the root issue? What's the root issue? Why is this happening? Well, we've talked about some of that, but underneath this, there's inflammation and there's deficiency. There's some kind of there are oftentimes obstacles to cure in the system. That means we're doing things that are not ideal for the system. Oftentimes this is diet. That's why I'm so big on identifying food intolerance. But basically underneath what the whole thing is inflammation and toxicity. And we know this because if we follow the principles of naturopathic medicine, we're going to know that abnormal composition of the blood and the lymph is what's going to set this stage up and kind of set up this storm to happen. And this is the piece that really needs to be connected. Inflammation and toxicity. Okay, those are two sort of nebulous terms, but to drill down a little bit on the inflammation part of it, the main piece of the inflammation piece is going to be a derangement in the insulin systems. It's going to be a derangement and a mismanagement of the glucose in the system. The glucose metabolism gets compromised, and again, this process happens over weeks, months, years, 2 years, 5 years, 10 years, 20 years, okay, is how this process happens. And that's why we need to be on top of it. We need to really identify, to really be nourishing the system, nourishing the immune system, and keeping the inflammation down all along the way. Because what happens is the sugar systems get deranged, and this is most often due to directly due to the food that we're eating. It's directly related to the diet. And this is why for years I've been promoting to be mindful of the sugar intake, to be mindful of the glucose intake. And this is how we reverse diabetes and heal diabetes. But essentially what we're talking about with this whole range of metabolic disorders and metabolic syndrome, really, when you have the true perfect storm of weight gain and cholesterol issues, maybe blood pressure issues. These are all the signs that there is metabolic distress going on, and that you're in the process of setting up the perfect storm to confuse the immune system, to get that confusion between self and non-self, and then set up an autoimmune process, which means basically the immune system gets confused. And the inflammation due to the diet is the number one thing that will turn that process on. And if you wait until the point where it is turned on to where there are antibodies, it gets a little bit more difficult to address, but not impossible. And this is where the world where, primary will send you to rheumatologists will work you up, or endocrinologists will work you up, and hopefully be able to, well, not hopefully, in their minds, hopefully be able to come up with a diagnosis or something so that they can prescribe. And what's going to happen in that world, in the allopathic world, which is the dominant school of medicine, is basically biologics, a category of drugs that are supposed to act on the immune system. They're highly toxic. And steroids, which are basically just going to suppress the inflammation. So the deal with the inflammation is, and this is how it looks in the body, is it's sticky blood. And that blood moving through the system has kind of a sandpaper effect. And that's really what I call the slow burn. That means the house is on fire, and you better put the fire out. You have to do something to put the fire out, because if it goes on, that fire, it begins to derange the digestion. Then we get an alteration in the digestion. We get that toxemia that ensues, that low-level subclinical inflammatory process that happens. They won't be able to make any diagnosis in this state. This is subclinical. The MDs and the allopaths will not be able to make a diagnosis. This is the part of the story where you go to primary, you have symptoms, they refer you to specialists, and you have symptoms and you're telling them XYZ 1, 2, 3 is going on, and they're saying, nope, everything looks good, all your blood is checking out, why don't you just have some of ABC pharmaceutical and come back and see us, and we'll recheck you in 3 months, 6 months. You know, however that version of the story goes. There's multiple versions of the story, but you get the point. And that is the point where the disease has actually begun to manifest itself. There has been a manifestation of that disease process. And now what I want to do is just let's unwind that, because what I want to, one key process, one key thing that I want to introduce here is the disease process. And this is something that Ayurveda talks about and the Nature Cure talks about, but Ayurveda of course explains it wonderfully in how the disease process happens. Now, by the time disease is manifest, and certainly by the time it has been manifest, and there are high levels of inflammation in the system, perhaps to the point where there is destruction of tissue. For example, in the case of an ulcerative colitis or a Crohn's, there's going to be ulceration and true damage to the tissue. Or in, for example, in rheumatoid conditions where you're going to get such inflammation in the musculoskeletal system, in the hands, you will start to get the anatomic and the radiological changes, the bone changes that you'll see on an x-ray, and that is a more advanced pathology. And again, that we can certainly help that to slow that process down and hopefully halt that process, okay? But we want to catch this thing. We would really ideally like to intervene at a lower level. And so that disease process is actually, again, it's going to take years, and it's going to start with the abnormal composition of the blood and lymph through just a low level inflammation, and then that's going to accumulate in the system. And then that's going to provoke the inflammatory systems in the body. And then that's going to, over time, spread and disperse depending on the person's constitution, genetics, all these kinds of things. What is their susceptibility means what's going to happen, where is it going to go, where is it going to spread, and then where is it going to deposit. Then only then we're going to start to see that manifestation phase, which is the phase where the allopaths can diagnose it, or things truly start to show up on lab work. And then eventually we're going to get the destruction of the tissue. So that is how the process happens. That is the disease process. This process of accumulation, provocation, of spread, of deposition, of manifestation, and then finally resulting in the destruction of biologic tissue, of the gut, of the bones, of the skin, depending on what the susceptibility is. That's how it's going to turn out. And this is where, and those of you guys that have been with me for a while or heard me say this before, I say this a lot, and this is, and I say this quite a bit, it's important to know. It's like somebody wants to know, well, can you help this? What can you do anything about this? And well, the answer is it depends. Where are you on this spectrum? And if you are in the accumulation, provocation, spread phase, the early stages of the disease process, I would call that would be categorized as what we call functional disturbance. Means there's just a derangement in the functioning of the system, but if caught in time, if addressed early, if the obstacles are removed and the blood and the lymph is cleansed and the body is nourished and the vital force is stimulated, the immune system can turn itself on, begin to correct itself, get the inflammation down, reverse the process. Okay? That's ideal. That is the domain of prevention, and that's why I think people should come in and get somebody to start working you up and identifying these things and looking for these things before we get to the manifestation stage where they're able to actually make a diagnosis because when you're able to make a diagnosis, you have progressed into the deposition, the manifestation, and the destruction phase of the disease process. And that puts us in the domain of organic damage. So we differentiate between functional disturbance, early disease process, provocation, spread, deposition, and then organic change, tissues changed in the body. This means you're in the deposition, manifestation, destruction phase of the disease process. Now that's the part where you can still intervene there, and you better intervene there, because if you don't, the house is just going to burn, and you're going to be stuck with allopathic drugs, which then again that's gonna get you stuck on a slippery slope of a negative cycle. So we got to intervene at either level. And so the question is, how do we intervene? How do we intervene? What do we do to intervene there? And there's a lot that could be done, but I want to talk about food. I want to talk about food as medicine, because that is my goal as a nature cure doc, as a vitalist, as a true vitalist. I'm really looking for the magic of the minimum, the lowest level of force, the lowest level of intervention that is necessary to gently, effectively, and in a lasting way, restore balance to the system. And the way that we can do that is with food. And so historically, there are two ways that we can go about this. Well, first of all, if you go on Google and look at this, you will be totally lost and totally confused, because it's almost as if the information is just mumble jumbled there on Google, and it's almost like the misinformation and things come up first. That's a different issue. I'll try to keep it clean, but you get the point. One other thing to just note, I just thought of this, and I think this is really important as far as like what's an autoimmune disease. I think there's a whole nother category or component of autoimmune issues that people don't talk about, that certainly we don't learn in medical school and they don't teach in the textbooks. There is a mental diagnoses, anxiety, depression, mood disorders, and the whole range of generalized anxiety disorders, a whole range of mood disorders. There is an autoimmune component, and it's due to inflammation in the brain. It's a kind of encephalitis. It's a toxic encephalopathy, and again, depending on the person's susceptibility, they might get depressed or anxious or go crazy or have whatever the constitutional susceptibility is for that person. It will express in that way. So keep that in mind when we're talking about keeping inflammation down and keeping the immune system dialed in. Now, most if you go on to the dominant school of medicine's information, this is where I want to talk about. It's really kind of the big breakthrough clinically, and this is what really kind of triggered the office hours topic here. Was I have always used plant-based diets, and really heavily plant-based diet, of course, juice fasting and the variations of that, and heavy plant-based diet to get the inflammation down and address autoimmunity. I've done that for a long time, and it has been successful in some people. It's been successful in a lot of people, but it's been successful in a few people long term. But what I started to see was that it wasn't sticking. It wasn't there were people that were really following, I mean, heavy plant food, heavy live food, heavy vegan diet, and it wasn't working. It wasn't working, and this is really what got me thinking. And I started a couple of years ago really having to take a close look at this. I guess about 3 years ago, I had to take a close look at this, because I had become heavily invested in this plant-based model and this plant-based understanding. But what I saw is it wasn't working with everybody, and some people it was even aggravating them. So what's up with that? What's up with that? Why is the live food diet and a plant-based diet supposed to be the magic bullet for the inflammation? And it is short term, but what I found was that a lot of people were relapsing and having flare-ups, or it might work in in a short-term phase and then things would come back and it's like it was not sticking. So long story short, what I started doing over the last few years, and now what really kind of what was the impetus to start sharing this with you guys, was the secret that I found and what I'm doing with a lot of people are heavy animal-based diets, essentially carnivore diets, which this is drastically different than what I've done historically. So, but what I've seen is, and I can share one case study and example, one individual that I've worked with for years, since like 2016 or so, 16, 17. And it's been a little this up and down. We've done all kinds of detoxes, multiple rounds of fasting, various forms of keto, raw food keto, vegan keto, a lot of different variations. So the low carbohydrate portion was there, but something was still not going on. Now, the big parts of what we got to do is addressing the insulin systems, and that means following low carbohydrate. That's what we got to do. And now how we're going to actually do that, I think, again, it's depending on the individual. But if you're having issues with the immune system, either a true autoimmune or issues that you think are that are resistant to therapies, it's highly likely that it is autoimmune condition. And if you have had up and down success with different dietary tweaks and things that you've done, number one, you got to go the low carbohydrate. But here's what's happening. If there's inflammation in the system, then the gut is inflamed. And if the gut is inflamed, the gut is supposed to have these areas we call tight junctions, and they're sealed. Stuff from the outside is not supposed to be permeable and get through there. But what happens here, and what I think is happening here, what the mechanism is here, is that there is a low-lying inflammation. They may or may not have digestive symptoms, which can make it tricky. And the low-lying inflammation basically opens up those gap junctions in the digestion. And when that happens, if there's heavy live food, heavy fiber, heavy plant-based diet, that can actually aggravate, and then we get that leaking of potentially inflammatory things like phytic acid, oxalic acid, some of these other things, the lectins, the gluten, these things. Those things leak in, and then we really get an inflammation. And that person, that situation will aggravate on the plant foods. They may get better for a little while. Oftentimes they'll aggravate. So what we're doing now with a lot of people, again, this needs individual attention, but you know your body and you can try things out. What I have seen with the most sensitive people is going essentially on a carnivore diet, which means purely meat. And when I'm talking about meats, I'm talking about the good, of course, the good clean, the grass-fed, the grass-finished, and the wild caught, the pasture-raised, free-range sources of the animal products that are as humanely raised and humanely harvested as possible. Now that we open that can of worms, we're saying the carnivore diet and an animal-based diet is potentially better at curing, handling autoimmune conditions. It's animal-based is better than plant-based in certain situations. That's what I'm saying, and that is really a drastically kind of a different thing than we've looked at historically. And a lot of people are seeing this and are experimenting with this and are testing this out clinically and getting really good results. So, interesting to note, animal-based products can heal the insulin systems in the system and can basically eradicate the inflammation. And then over time, what I think will happen with even those cases where we're using 100% carnivore, and on one end of carnivore we have completely grass-fed, grass-finished red meats. Boom. That person, and that still sounds a little crazy to even say that, but I have to say, clinically, I've seen it working, and it is actually working. And this is what I'm seeing in real life, and this is the real litmus test, and this is with a couple of people. So there's a few of you guys out there that I still need to have this talk with, so please, I hope you see this. I'm going to refer you and have you guys watch this, and then we're going to unpack it together. So trying to glean the lessons and glean the pearls out of a couple 1, 2, 3, 4 case studies and share them with the masses. That's really sort of the whole point, is to scale the information. So animal-based versus plant-based. For autoimmunity, I think the clinical trial is in progress, guys, and I want anybody that has some information about this, any of you guys especially in the circle, comment, let me know what you think about this, let me know your questions. I think I just opened up a whole potential can of worms here with animal-based being better than plant-based, and maybe even being 100% animal-based, meaning like mono diet, lion diet, carnivore diet, grass-fed, grass-finished red meats, as a mechanism, as a vehicle, as a therapeutic tool to heal and nourish the immune system, to bring in all the bioavailable, highly absorbable nutrients, because that's what the system needs when the digestion has been compromised and we have leaky gut, and then we have inflammation in the system, and we have blood sugar dysregulation going on. You can heal this. And then I think over time, we will make our way back to the middle path where we're incorporating some of these things in. So that's the session that I wanted to do today. I kind of had these main topics in mind. So you guys leave some comments. Let me know what you think, please. And let's pick it up here next time. We're going to do office hours again next week. I hope you guys take a look and enjoy the session today. Adios for now.